The landscape in sickle cell disease has evolved quite a bit over the last 6 months to a year. Very exciting time for physicians and patients and individuals living with sickle cell disease, because there's been several new treatments that have been approved that have really increased the options that physicians have in their discussions with their patients about what would be the best treatment for them. One of them, of course, is Oxbryta, the drug that was recently approved at the end of last year by GBT, but there's other treatments as well that have been developed by Novartis. And now I think physicians are really looking at their patients and thinking in a much broader way about what are the different ways that I could address the different components of their disease and potentially think about long-term outcomes. And that's really changed the landscape in a fundamental way and has really changed the conversations that physicians are having with their patients. And particularly now that there's a treatment that's approved that raises hemoglobin and reduces hemolysis specifically by design, that's really giving physicians a different way of thinking about how do I define treatment success for my patients. There used to be a very strong component of trying to simply manage pain, which is clearly an important component of the disease of sickle cell, but there's other aspects to it as well, which are related to the chronic anemia and hemolysis associated with that disease, and the ability to treat that directly and to potentially prevent the long-term sequelae is really changing the way that physicians think about what treatment goals they may have for their patients. What's unique about Oxbryta is that it was designed from the beginning specifically to treat sickle cell disease. It's not medicine that was repurposed from other uses such as hydroxyurea, which has been used for a long time and has been effective in managing some of the complications of sickle cell disease. But Oxbryta directly inhibits the root cause of sickle cell disease, which is polymerization of the sickle hemoglobin molecule. And the reason that's important is that when those sickle hemoglobin molecules polymerize, they form rigid chains and rods that distort and damage red blood cells. And that causes a variety of downstream complications. It causes those red cells to break open and to spill their contents into the blood, and that causes the anemia, the drop in the hemoglobin value, and also causes a lot of the complications associated with that anemia in terms of the ability of the organs to have oxygen delivered to the tissues. In addition, those damaged red cells can clog blood vessels and cause vaso-occlusive crises, which are thought to be associated with the pain symptomatology that sickle cell patients have. So the ability to, with an oral treatment that's given once a day, to actually directly inhibit that initiating process in the cascade of sickle cell disease pathophysiology was really a major step forward, and why I think many physicians are excited about the potential for Oxbryta to ultimately have a huge impact on their patients' outcomes.